And joining us live to share Nigeria's perspective on healthy beginnings, hopeful futures on World Health Day is the Minister of State Health, Dr. Salako. Thank you for joining the Network News on NTA.
Thank you very much. It's my pleasure to be here.
So, Honorable Minister, in line with the theme, Healthy Beginnings, Hopeful Future, let's talk about how the ministry is aligning its policies with this vision.
Once again, thank you. I must say that the theme of this year's World Health Day celebration, Healthy Beginnings, Hopeful Future, is a very profound statement because it connotes that if we're able to give our children a very good beginning, a healthy beginning, there is a hopeful future, not just for themselves, but also for Nigeria as a country, because our children represent the future of our country. For us, therefore, in the Federal Ministry of Health and Social Welfare, and indeed in the federal government of Nigeria, you will see that the agenda of Mr. President is about hope renewal, it's about securing the future, it's about a brighter future for Nigerians, for Nigerian children, for Nigerian women. So as a result of that, we have developed the Health Sector Renewal Investment Initiative, which is a blueprint to ensure that we're able to deliver health, we're able to ensure that Nigerians do not suffer pains physically and financially. We're able to ensure that every Nigerian have access to the kind of health they need at any point in time without any financial hardship. Talking specifically about maternal and child health, we are approaching in a very comprehensive sector-wide approach, ensuring that every level of government is involved and ensuring that we take services to the grassroots and we utilize data in coming up with an initiative to address the challenges of maternal mortality and under-5 mortality in our country. As an example, we have developed a special initiative called MAMI. And MAMI is targeting 172 local governments in Nigeria. These 172 local governments spread around 33 states have the highest burden of maternal mortality in Nigeria. In fact, they contribute about 50% of the maternal mortality in Nigeria. So, using data, we are targeting those local governments to ensure that we upscale the delivery of maternal and child health services in those local governments. Those services have started already in about 7 local governments, and we're hoping that before the end of this year, we'll scale it up to cover the rest in about 7 states out of 33 states, to ensure that we scale it up to cover the rest of the local government concerned. So this MAMI program is targeted at ensuring that those delays that causes maternal mortality, delay in taking decision at home, delay in getting to the hospital, and delay in getting care when you reach the hospital is frontally addressed by providing infrastructure, by ensuring that transport ambulance services is provided, and this ambulance services is also provided without any financial ask, and also by increasing the level of awareness so that women are better empowered and men are also involved in the antenatal care for their wives. We think that if we're able to do all this, we can take services closer to the people and we can reduce the ratio of maternal mortality in our country. Of course, we're also focusing on improving the skill of the frontline health workers, particularly our midwives, our doctors, our nurses. We're also doing what we call tax shifting and tax sharing to ensure we better skill community health workers to be able to perform maternal health services within the villages, within the communities at the grassroots level. So putting all this together, we're assured that the deliverable to ensure that by 2027 would reduce the maternal mortality rate in Nigeria by at least 20% and the under-5 mortality by at least 15% will be achieved.
Now, Honorable Minister, you've addressed prenatal and postnatal care as well as access to primary health care for the teeming Nigerians. But let's go back to the immunization and nutrition, which are important indices for early childhood development. Statistics show that malnutrition remains a major issue. So what is being done to address this?
Well, you will recall that a few months ago, earlier this year, we launched what we call the Nutrition 774 initiative. The Nutrition 774 initiative is an initiative of the federal government in cooperation with the state and the local government to take nutritional intervention to the grassroots, ensuring that our local government take ownership of nutrition interventions. This initiative was launched here in Abuja by the Vice President, Senator Kashim Shettima. And as a result of that, we're encouraging subnational governments to not only create nutritional departments, the ministries of health, and the Ministry of Agriculture, and other line ministries that are delivering nutritional services. We're also encouraging subnational governments to create budget lines for nutrition interventions so that we can have resources mobilized to intervene at the national level. We're encouraging development of local capacity to manufacture ready-to-use therapeutic food, and once we have this kind of facilities, it can help us to intervene very quickly in nutritional challenges, particularly in crisis-prone areas. Already, the school feeding program is being reworked, and the Ministry of Health is involved with the Ministry of Humanitarian Affairs, and hopefully very soon that will also be reintroduced into the Nigerian public so that our children in school can have better nutrition and then they can be better supported in their growth. With respect to immunization, we have expanded our immunization services. You must remember that last year we introduced for the first time routine immunization against human papillomavirus virus to protect our girls against cervical cancer. That is being imparted, and within 1 year, or about less than a year, we're able to immunize more than 12 million children, and this year we target to immunize additional at least 6 million children. So you see that both are going on, and both are very important interventions to ensure that we maintain the health of our children.
Finally, Honorable Minister, any last words for Nigerians on World Health Day?
Well, just to encourage our people, first to take ownership of their health. Health is a greatest asset that anybody can have. Yes, government will do its bit, but individuals too must take ownership. Take ownership by observing simple preventive measures, cleanliness, hand washing, good nutrition. And when we talk about good nutrition, we're not necessarily talking about expensive nutrition. Exercise, appropriate exercise, and other health habits that are anti-health, like smoking, quit smoking, manage alcohol, make sure that you do not consume alcohol in excess, drug abuse, stay away from drug abuse, and so on and so forth. All this, when we observe them, it helps us to stay in very good health, because these are very simple preventive measures that does not cost much, but that has a lot of value to promoting the health of the people. So I encourage our people to take ownership by also subscribing to health insurance, saving for the rainy day, so that anytime we fall ill, we do not necessarily have to dip our hand in the pocket to take health care.
So subscribe to health insurance, maintain healthy habits, and support women and children to reduce maternal and newborn mortality. That's the message from the Minister of State for Health and Social Welfare, Dr. Isiaq Salako, on World Health Day. Thank you very much, Honorable Minister.
Thank you for having me.